So, did you always want to be a doctor?
Hmm. No, I really didn't. I didn't plan to be a doctor until I went to college. I was actually planning on being, well, first I started out wanting to do sports medicine, and I started in the sports medicine program at the college I went to, and then realized that I probably wanted to do a little bit more, and so then I changed my mind and wanted to do physical therapy. And then I started volunteering. I kind of did like you're doing. I did an internship in a physical therapy's office. Volunteered my sophomore year in college, and thought it kind of was a little too repetitive for me. And that's when I started thinking about what else I could do, and I decided to go into medicine at that point. I actually babysat for a doctor and his family when I was in high school, and I saw how hard he worked, and he never got home till 9:30 every night. And I, said I would never ever go on to be a doctor. And but then actually, when I got to college and started thinking about what kind of a lifestyle I wanted and what I wanted to do that would still be challenging, and it kind of ended up in medicine. And so when I was in college, I started working with a ER doc that I knew, and I just volunteered in the ER like my junior year in college, and then decided to go on to medical school and took the MCATs and went to medical school.
So, how did you choose to go into orthopedics?
That's a good question. So when I went to medical school, I was planning to either do emergency medicine or pediatrics, because those were the two things that interested me the most. And I got to medical school and I did a month. And well, when we first did when you go to medical school, the first 2 years are all book work, and the last 2 years are kind of all clinicals. And so when I started out my clinical year, in my third year, I rotated through the ER and just found that I thought the orthopedic stuff was very fascinating, and I actually did an elective month in orthopedics, and I really liked it. Thought it was a lot of fun, but had no intentions whatever of becoming a surgeon, because I didn't think I would be able to maintain a decent lifestyle and have a family and children if I became a surgeon. So I wasn't going to do it, but I really had a lot of fun with it. And then I went through my other rotations, and like I said, I went through the ER rotation, and then I went through the peds rotation, and I didn't really interest me that much. I just the month I did in orthopedics, taking trauma call and putting rods and fractures and plates and screws and replacing joints, everything about it was so fascinating, and I really liked that patients got better, and I actually felt like you were doing something to actually make them better and improve their quality of life. So I really liked it, and then I just decided that I guess I would become a surgeon. So because it was the only thing that I really wanted to do once I finished all my clinical rotations. So.
What do you like most about your job?
I like the variety. I like that, one day I can see someone with, knee arthritis, and then see someone with a hand fracture, and then turn around and see someone with shoulder pain and weakness, and it's just a variety. And the other thing I like is that there's a wide spectrum of patients that I see. I can see from pediatrics all the way, up to, elderly patients. Most of my patients tend to be really healthy, in the sense that, they're healthy and they're trying to get back to activity and trying to get back to sport and that sort of thing. I actually like that I don't deal a lot with things like cancer and things where there's a, kind of more dismal prognosis. I think that's really hard for me. My husband's a urologist, and he deals a little more with cancer, and I think that's really hard. So those are a few of the things that I like about it. So
what do you like least about your job?
Paperwork.
Yeah.
I hate doing charts. I hate doing notes. I love having very well documented notes so that I know exactly what's going on with that patient. So the next time I see him, I know exactly where I left off. But I hate doing the paperwork.
Yeah.
And then that's really it. I don't mind taking call. Call's not bad. I like seeing patients. I love doing surgery. Everything else about it I love. I hate the paperwork.
Yeah. What do you think is like the most challenging aspect of your work?
trying to stay up to date on new advancements, new treatment options, trying to just stay up to date on all the literature. I think that's probably the most challenging because you come to work, you take care of patients, you do your paperwork, you do your surgeries, you do all that. And then on top of that, just trying to, keep well abreast of all the things that are going on, reading the journals, looking at websites that show different procedures that, are new and that sort of thing. I think that's probably the hardest thing, most challenging thing.
What was the most exciting or interesting surgery you have performed or just observed as well?
I have no idea. That's a good question. I'm trying to think. Gosh, I don't know. That's a hard question. I don't know. I think joint replacements to me are the most interesting surgery. But there's not one particular case that stands out as being, at least it doesn't right now. Maybe I'll think of something later. But I think, hip and knee replacements are certainly very cool. They're very interesting. I mean, you go in and you shave off all the old surfaces and you put on this new implant that fits perfectly. And I just think that's really cool.
So, are knee and hip replacements your favorite surgeries to perform, or?
Yes and no. I like those, but I also like doing fracture work because fracture work is always variable. Every fracture is different, and it's always like a puzzle to put back together. I like doing hand surgery. So there are, again, it's just that broad spectrum that you can still practice, but they're among the most fun surgeries that I do.
What was it like the first time you cut someone open?
Oh gosh, I don't remember. Wow, I honestly don't remember. I don't remember. It's
Do you
been
remember
so
what your
long
first
ago.
surgery was?
I remember going in as a medical student, and my first surgery on my orthopedic rotation was this. Was a forearm surgery. No, I don't remember exactly what it was. It was either an ulnar shortening osteotomy or some sort of osteotomy of the radius. I don't even remember. I remember it was in the forearm.
Yeah.
I remember thinking it was really cool, but I don't remember exactly what it was. No, I don't. It's been 17 years ago, so I don't remember what it was.
All right. Well, that's the end of it. So thank you.
Cool. And yeah, you can probably